There are many benefits that we can encourage pregnant women to exercise, and many times if a woman knows these benefits, that might increase her motivation to exercise. But some of these benefits are just an increase in maternal well-being, helps her to decrease her stress levels and anxiety levels and depression levels, all which would be healthier overall for the baby. An increase in self-image. She feels better about herself and what she's doing to help herself as well as her baby. Increased social support if she's doing this with someone else. Also a sense of control. More specifically, related to strength exercises and the benefits of strength exercise, often when we talk about making recommendations for exercise, we often focus on the cardiovascular benefits or cardio exercise, aerobic exercise, but also there are many benefits to strength exercise and in pregnancy. And in pregnancy, exercise increases the ability to meet the musculoskeletal demands of pregnancy. As there's an increased girth, the woman is gaining extra weight. There's increased lordosis, as we already mentioned. There becomes an altered center of gravity as her weight increases. These types of exercise also help strengthen the pelvic floor muscles and may assist pushing during delivery. And from the few studies that have been conducted, there is no adverse findings that have been reported when exercise involving light to moderate weight training, free weights, or a combination of free weights and stretching. And as resistance training strengthens muscles, it may help pregnant women tolerate their heavy body weight, as I mentioned, and the altered center of gravity more easily. And also there may be a low back or reduced back pain due to the truncal musculature, due to these strengthening exercises. Often women are more motivated knowing the benefits to their babies. A woman may find, well, she's been told that she can maybe control her weight, have some extra benefits for exercise for herself, but may not be necessarily as motivated as if they know that they are actually benefiting their baby by doing exercise. So there's some short and long-term benefits for the offspring of women who exercise during pregnancy. And although there has been limited studies available, they do indicate there's a possible decreased risk of childhood obesity, childhood type 2 diabetes, childhood metabolic syndrome, which is prediabetes and hyperlipidemia, which I see many children have this currently. And there's not a decreased risk of, but this is actually should be a separate bullet point, but there's also advanced cerebral maturation. And research from the University of Montreal studied women who exercise starting at the second trimester, at least 20 minutes of moderate intensity cardiovascular exercise. These researchers measured the baby's brain activities, and the results showed that babies with mothers who were more physically active had more cerebral activation, suggesting the brains developed more rapidly. And they were doing continuing studies on this. Hopefully, after a year, the baby is 1 year old and older. Other studies by Clapp, at the age of 5, babies born from exercising mothers were 2 kilograms lighter, had less subcutaneous fat, and scored significantly higher on tests of oral language skills and general intelligence. And this is possibly why we see a decrease in the risk of the type 2 diabetes, metabolic syndrome risk to these children at a later date. Some additional benefits of aerobic exercise is it improves a woman's endurance, her ability to handle everyday activities, increases exercise capacity, helps her to cope with metabolic demands of pregnancy that we already mentioned earlier. Those changes such as the increased circulation of the blood volume, increased cardiac output, and increased ventilation. It also improves muscular strength during labor and delivery, and so she may have those added benefits that may help her through labor. And in addition to that, it makes it easier for the women to get back into shape after her baby is born. According to the American College of Sports Medicine, a healthy woman with a normal pregnancy may either continue her regular exercise or begin a new exercise during pregnancy. However, a woman should check with her physician first, even if she has been previously active, to rule out any possible contraindications. According to the ACOG guidelines, the following considerations need to be given prior to starting an exercise program during pregnancy, and these are included here. These contraindications, women are not to exercise. These include pregnancy-induced hypertension, incompetent cervix, multiple gestation at the risk of premature labor, persistent second or third trimester bleeding, placenta previa after 28 weeks of gestation, preterm labor during current pregnancy, rupture of membranes, and preeclampsia or pregnancy-induced hypertension. So again, these are absolute contraindications. Women are not to exercise. Now there's what we call relative contraindications to exercise, and these women may be able to exercise, but they need to seek medical advice before undertaking any type of exercise during pregnancy. And these are all included here. Women such have heart problems, high blood pressure, cardiac arrhythmias, anemia, asthma or any chronic lung problems, poorly controlled diabetes, which could include women with pre-existing diabetes or a woman who has gestational diabetes who is poorly controlled. Thyroid problems in uncontrolled thyroid disease in pregnancy can lead to congestive heart failure, preeclampsia, miscarriage, premature birth, low birth weight. Because thyroid hormones are crucial to fetal brain and nervous system development, hypothyroidism can affect baby's growth and development. So not that a woman who has thyroid disease cannot exercise, she just needs to be evaluated prior to doing exercise. In addition, we have on this contraindication list is extremely overweight or underweight women. The concern with underweight women would be, you know, she could be possibly malnourished. She may come in with an eating disorder. She may not be obtaining adequate nutrients or calories. Also, for women who are extremely overweight, the extra burden of their weight and the fact that they may be very sedentary may put them at much higher risk. Also, women who have muscular or joint problems, history of spontaneous miscarriages, history of previous premature labor, women who may be having twins or triplets. These women just need to be evaluated. Also, someone who is previously sedentary lifestyle, depending on where they have extremely poor fitness, they just need to be evaluated. A woman who smokes, hopefully she is not smoking in pregnancy, but this would need to be evaluated also. In addition, information is limited with regard to the role of physical activity in women who are morbidly obese. And so these women really need to be individualized or put on an individualized exercise program. Exercise prescription in pregnancy should include basically the same elements of fitness as those for non-pregnant women. And a comprehensive exercise is best and should include some form of aerobic exercise, which we typically think of cardio exercise, and some examples here, such as swimming, walking, rowing, dancing, hiking, aerobics, or low-impact aerobics, stationary, bicycling, and more. Strength exercises, such as resistance training, yoga and Pilates, which are examples. Also flexibility, stretching, yoga, and Pilates. As we know, a woman's ability for exercise really differs greatly based upon individual abilities, preferences, and fitness level before pregnancy. So a woman who comes into pregnancy at a very fit level, the recommendations for her will be very different for someone, for a woman who has not been exercising. One component of exercise prescription is exercise intensity, or how hard a woman should be exercising. So the general recommendation is that women should be exercising at a moderate intensity, which is about equivalent to brisk walking. And how we measure that exercise intensity, as I mentioned before, heart rate is not the best measure at this point in time. Clinicians often use what we call the Borg scale, and the Borg scale is used clinically to measure how hard someone is exercising. It matches how hard someone feels they are working on a scale of 6 to 20, 6 being no feelings of exertion, to 20, which is very, very hard. And moderate intensity registers somewhere between 11, 12 to 14 on this scale. There is also a modified version of this, which is a 10-point scale, 1 to 10. There are several different versions of this scale. And so I chose to present the talk test version, which I'll show on the next slide, which may be better to use in pregnancy. And the intensity recommended is about a zone 5. And if you see here, here is an example of the rate of perceived exertion using the talk test method. And you can see the RPE of 5, which would be considered moderate. So if a woman is having a conversation during exercise, this conversation requires some effort, however, not at a point where she cannot talk at all, and a point where there's little breathlessness, but again, it requires some effort. And this is actually a very good handout that you can give women to help them gauge how hard they are actually working. And this will be also available to download from one of the sites I have at the end of the presentation. And as I mentioned, due to physiological changes in pregnancy, heart rate is not recommended to gauge exercise intensity in pregnancy. Intensity should be regulated by how hard a woman believes she is working. And also women who have been exercisers may actually be able to work at a higher rate and for a longer period of time. But it has to be individualized. Another component of exercise prescription is duration. How long should a woman be exercising? So most experts agree that a woman who is pregnant usually not exercise for more than 45 to 60 minutes due to the risk of overheating and potential for dehydration, and hypoglycemia, especially if a woman is taking insulin. The American College of Sports Medicine and the Centers of Disease Control suggest about 30 minutes on most days, if not all days of the week. If a woman is exercising to control blood sugars, there's an emphasis on consistency and recommending this 30 minutes almost on a daily basis.